morning. This is Stephanie Rawlinson, and we're at the South Carolina Department of Disabilities and Special Needs in this convention meeting for the month of July. It is 10 a.m. and I'm calling this meeting to order. The first order of business is the notice of meeting statement. Commissioner Blackwood, do you have that?
Yes. A meeting notice announcing the date, time, and place of the July 15th, 2021 commission meeting was distributed July 13th, 2021 to appropriate media and other groups or individuals who have requested notification. The announcement and agenda were posted at the Department of Disabilities and Special Needs Central Administrative Office and on the website. The public has been notified that accommodations such as interpreters, mobility assistance, or other assistance will be provided to the individuals with disabilities and special needs if requested in advance.
Thank you, Ms. Blackwood. I just want to welcome you all this morning to our meeting. This is kind of exciting for us as commissioners to finally have people in the audience. So we're glad to be open again for our community and our constituents to be able to come and talk with us. Welcome the staff that's here with us this morning. I think we have two guests. Would you like to introduce yourself?
Sure. I'm Dean Redd with the Carlton County Board of Disabilities, and it is so nice to be amongst you again.
We're glad to have you. Glad to have you.
Andrew Darren, I'm here at DDSN with the agency. So.
Okay. Anybody else that's a guest? All right. I think the rest are staff that are speaking today. So welcome again, and please know that if you would like to speak in our meetings, that we do offer a public input section at the beginning of our meetings. You do have to show up 30 minutes ahead of time and at least sign in so that we know you're going to be here to speak. I would remind our commissioners, we have a new sound system here in our office, in our chambers, and it is in the ceiling. So no buttons to push anymore, but when we go live, you are live. So anything you say can be heard by the folks out in the audience, in the viewing audience. All right, we're going to move on now to the adoption of the agenda. As you see it printed in front of you, is there a motion to adopt?
So moved.
Second, Barry Melvers.
Any discussion on the matter? Hearing none, we will move forward. All in favor of the motion adoption of the agenda, please signify by saying aye.
Aye.
Opposed, nay. Hearing none, the agenda is adopted. All right, I'm going to call on our esteemed Commissioner Miller to give our invocation this morning.
Let us pray. Lord of all, lift our parents and caregivers of children with disabilities. Refresh them. Give them strength to press on each day. For families living in poverty, lead them to economic opportunities to provide each member with the resources to survive and thrive. In Jesus' name we pray, amen.
Amen. Okay, next we're going to move on to the approval of the commission meeting minutes. We have the June 17th, June 30th, and July 14th special call meeting minute. Do we want to take these as a whole, or do we want to take them individually? And are there any changes to the minutes that anyone sees?
I think it'd be fine to take them as a whole.
Are there any changes? All right, you got a motion?
Yeah, I make a motion that we accept them as a whole.
Second.
Okay, I have a motion and a second to accept all the minutes as presented. Is there any discussion on the matter? Hearing none, the motion is ready to move forward. All in favor of accepting the minutes, please signify by saying aye.
Aye.
All opposed? Aye was up there. All opposed, nay. Hearing none, the motion carries and the minutes are approved. All right, we have commissioner update time. Commissioner Miller, do you have anything? Okay. Commissioner Malhurst?
I just had a cartoon that I passed around to everybody that I'd like for you to see. And if anybody wants to see it, it's out there. They certainly can come look at it. It's mindful of
HIPAA.
Of the HIPAA and the vaccine and the privacy rights of people. So just wanted to remind people of that.
Okay. Commissioner Blackwood, you want to talk about?
Yeah, yes, I do have an update. So you have in front of you a governor's proclamation regarding Fragile X Awareness Day. And the reason it's in front of you is because I wanted just to bring attention to Fragile X syndrome, which is a condition that my son has. And July 22nd is a National Fragile X Awareness Day, and the governor, Henry McMaster, signed a proclamation, bringing some awareness to Fragile X for our state. And I greatly appreciate that, and just wanted to speak a minute about Fragile X. Typically, children with Fragile X have developmental delays, and until a blood test is done, you don't know what is causing the delays. And if it is Fragile X, you can intervene and get interventions quickly. And that was the case with my son, Sam. We benefited from the BabyNet system and early intervention. We were diagnosed by Greenwood Genetics in their lab that does great work around Fragile X specifically. And I just wanted, I try to advocate for, so others can learn more about Fragile X. And for the most part, the reason that I'm on this commission is because of Sam. And so I just wanted to take a few minutes and share a little bit about Fragile X. Thank you.
Thank you, Commissioner Buckwood. Commissioner Thomas, do you have any updates?
No, thank you.
No, ma'am.
All right, we're going to move on then. We didn't have anyone to sign up for public comment, so we will be skipping number 8. There's no public comment today. Now we're going to move into committee business. And the first committee is the Finance and Audit Committee. I'm going to call on Commissioner Robin Blackwood, who is the chairman of the Finance and Audit Committee, to give that update.
Thank you. So on tab 3, you will find some of the updates from our last subcommittee meeting or committee meeting for the Finance and Audit, where we reviewed 3 new non-service contracts of $200,000 or greater. These were kind of ranged in a variety of areas, which are outlined for you in your binder. We made a motion in the meeting to approve the items under item number 1 because they were routine in nature, and just share with the full commission these items listed here so that you can see what we reviewed in our committee meeting and what we approved to for the agency to move forward with 3 new non-service contracts. And so today it's just those items listed, and if anyone has any questions about them, but we don't need a formal vote for today based on the nature of those 3 items being very routine in nature. So that's what
On the second page, do we have the one?
So yeah, the second page has, it was regarding the comprehensive permanent improvement plan to replace 26 variable air volume terminals. This was a project that was originally approved on May 20th of this year. And the update on it is bids were received on June 8th through the South Carolina Business Opportunities advertisement, and 1 bid was received by Gregory Electric Company for a base bid of $224,460. And this was presented to us, and we approved the spend, and are just bringing it, I think, to the commission for final approval. Is that how we did that, Pat? Okay.
Full vote by the commission.
Okay, okay.
So,
Is there any other, this is coming as a motion?
Yes.
Out of the committee?
yes.
Okay.
Yeah, a
Right.
motion and a second, right, out of committee or?
Motion and a second out of committee?
Right.
Okay, so we have the motion and second out of committee on this. Is there any discussion on this matter?
This is for the Witten Center dorm, 205, just.
Okay, any other discussion? Okay, hearing none, I'm going to call for the vote to approve this. All in favor, please signify by saying aye.
Aye.
All opposed? Hearing none, the motion carries and that expense is approved.
Thank you. That's all I have out of that.
If I didn't see. Yeah, no, wonderful. All right, well, we will move on then to the policy committee and Commissioner Malfris.
Thank you, ma'am. The first item on the agenda for the policy committee is individual service delivery records management, which was related to, which was a staff revision that we made in one of the policies. Susan, is there anything special you want to say about that?
I'll just indicate that this was referred to staff for revision and some refinements were made to make it a little bit easier to follow. There are lots of requirements regarding records retention, and so we've kind of moved some of that information into a table, which is a lot easier for providers. We got good feedback on that. So it was submitted for public comment, and really the comments that came back were grammatical in nature, so no additional major changes were made, and so that is ready for commission approval.
We would just ask those to be mindful that unless it's a major grammatical error, Susan's really good with grammatical, so we don't really need grammatical errors much pointed out. But if it's more than that, we appreciate it. The next, well, we need a motion to approve that.
That's a motion out of committee.
Motion in a second coming out of committee to approve that.
Okay, is there any discussion on this policy?
As presented, it still has my name down as chairman on the signature blank.
Okay.
So I think it should be amended to reflect that change. And we make a motion to amend it as presented, substituted chairperson
That's fine.
Rollinson for me, because as presented, it's no longer accurate. So I would make that motion to amend that element.
Do we have a second on that?
Second.
Okay. All right, so we have a motion and a second to do that amendment. Is there any other discussion? Discussion on that? Okay, let's vote on the amendment first. All in favor of the amendment, please signify by saying aye.
Aye.
Hearing none, the amendment carries. Now we'll vote on the actual motion and second that came out of committee to approve the policy with the amendment. All right, second on that? We already had a second out of committee.
Yeah, we have a
Second.
second.
Okay. All in favor, please signify by saying aye.
Aye.
All opposed? Okay, hearing no nays, this motion will carry and this policy is approved. All right, anything
Okay,
else?
the next item on the agenda for the policy committee is the much talked about outside employment policy. I'm going to read this again because there's so many concerns about this policy, so I'm going to read this about the purpose again. The purpose of the directive is to describe the guidance by DDSN employees that request and obtain approval of outside employment, where outside employment creates an appearance of impropriety, conflict of interest, or interferes with an employee's ability to perform their duties at DDSN satisfactorily. DDSN maintains the authority to disapprove such outside employment, withdraw approval for such outside employment, and take appropriate disciplinary action, including termination. I just said it, but the primary reason for the policy is to make sure that we don't have any conflict of interest. And we are continuing to go through and over this policy, and we're not even asking for a vote today. We're just bringing up the fact that we are going back through it, and we went through it on July 13th. We're going to make a couple of other edits in August, it appears, and then we'll bring it back to the commission after a truly thorough vetting in August.
And what is the directive called, and what's the number?
It's 41309DD, called outside employment.
Is this a brand new directive, or is this one we've just?
It's a brand new directive. A lot of it comes out of some of it comes out of another directive that we have called,
I think there's some related content in code of conduct.
in the code of conduct, yes. A lot of it's, some of it's in the code of conduct, but this is just much more detailed, and some of our people did quite a bit of work on this policy, but there's still a little bit more to be done, so we will be working on it again. I'm sorry that we're bogging down a little bit in the policy committee on certain things, but certain things are particularly important, so we have to go back to them again. So anyway, that's informational, so there's no vote on that. And the next item on the agenda is, or on our agenda is, the committee approved the documents for the review of for this year. They will appear on the website, and at any time, somebody can make public comment about any of our directives, but we will be working on a particular, how many is it, Susan, per year?
45.
45 a year, and we're going to have to be working hard this year to get to our 45, because we've been bogging down the last couple of months, but we're going to try to do it. And those have been, we've been through those, and those are the ones we're going to go through, and you'll see them on the website if you'd like to look at them. The policy committee also made a few edits to their committee procedure, which we will not ask for approval until all of them are ready to be approved. They are really, talks about an obsolete list that we have for those policies that made obsolete, and about, this is a big, not a big one, but a good one to mention. Our policy used to say that we would comment, we would respond to all comments, and now it's then going to say we may or may not respond. Just depends on, that primarily is in case we miss one, so somebody won't think we've broken some kind of a rule or something. We can not comment if we don't want to or don't need to. Anyway, we'll bring that back up whenever they go for approval, all of them at one time.
Okay.
And that's all we have in the policy committee today.
Well, thank you, Commissioner Malphurs. We appreciate your update. We are next moving on to old business. The first one is under tab 5. I spent the month working with our staff and with our executive director, our CFO, with Mr. Rufus Britt, and with our legal counsel to develop a committee-type structure that we can use at DDSN. Not just, we have our formal committees that are set forth, but what we're trying to do is set forth some subcommittees and task force that can actually bring in the community so that we can actually have interaction with people in the community and actually get your feedback and get the feedback of those that we serve and the providers out in our network. So that is the goal of these subcommittees that I'm fixing to propose to you. The subcommittees will take no votes. They will not be public meetings. They will be closed-door meetings with these subcommittees, and then they will bring to the full commission recommendations, ideas, things that we need to look at. Because I think there's some things that we need to look at in more depth as commissioners. And so these are the things that we've identified after going out into the community and doing the listening sessions. We were able to pick out areas where we saw there's an immediate need. Now, does this mean this is all that we're going to do? Absolutely not. We know that there are other areas where we need to look at, and we will, once we get this set up and running, we may add other subcommittees that we add on. These subcommittees will include not just DDSN commissioners, but it will include staff. It will include family members. It will include providers. So that's the purpose of this, is to get us all talking to each other so that we can all communicate and bring positive change and positive ideas together to form what we consider ideal at DDSN. So I'm going to go through them. Obviously, we've placed the committees, the major committees, which is legislative, finance, and policy. Those are committees that we've named in our bylaws. So those committees are legislative committee the chair will be Commissioner Eddie Miller, Commissioner David Thomas, and Commissioner Derry Kosher. will be on that committee with him. The Finance Committee will be Commissioner Robin Blackwood as chairman, Commissioner Eddie Miller and Commissioner Barry Malfris will serve with him on that committee on finance. And on policy is Commissioner Malfris is the chairman, Commissioner Thomas and Commissioner Lamel will serve on policy. Okay, so those are the main committees. I'd like to go ahead and let's approve the main committees, and then we'll go back and approve the subcommittees after we do that, if that's okay with you all. All right, do I have any motions on the floor?
So move the motion.
So move to approve the committees as I read them and the memberships.
Second.
Okay, and we have a second. Is there any discussion on that?
Do we even need to have, I thought, in the very year, the bylaws guru, under the bylaws, aren't committee appointments just in
That's
the
what I'm
hands
sure.
of the chairperson?
Are they what, in the hand, what?
In the hands of the chairperson. I thought the chairman- I mean, we can vote, I'm just saying, I don't know. if
Okay, I wasn't
that's-
sure.
I was always,
It doesn't hurt to vote. I never heard to vote because I like voting, but
Sure, I'm
that's
just
why I
saying.
didn't say anything. But
Okay.
technically, we wouldn't have to do it because they're in our bylaws, they
Okay.
exist in our bylaws. Now,
and I think.
I believe that the temporary ones, which is what we're doing next, should
Yes.
be voted on.
Okay, okay,
But as far as the appointments go, I
Technically, she has the authority to do it, but
okay.
I just like the idea of voting on it. But they are temporary committees, so they don't have policy, they don't have committee,
They don't have authority, yes, correct. Okay, so let's go ahead, so you got a motion and a second on the floor? Is that okay with you if we just go ahead
I'm
and
not
do it?
opposed, I was just asking the question about,
Sure.
the reason why I brought it up is I don't think we've ever
I wasn't sure.
voted on
Okay.
the committee appointments
no, I don't think we have.
before, in my time.
I don't think we have either.
Again, it doesn't hurt, I mean, I've got no problem with it, I got no problem with the process, but I don't want to set a precedent of something that goes
Yeah.
against
What
what
do
the
y'all
bylaws
think?
provide the commission of.
You want to withdraw your
chair.
motion?
Well, for the standing committees, we might should, because we don't want to set a precedent.
Okay,
Right.
why don't we remove that? Do you mind dropping your table in your
Withdraw
motion?
the motion, yes.
Okay, thank you. Second on the motion to
Second,
withdraw?
yeah.
Okay. All right, well, the motion is going to be withdrawn then on the main committees, but that is what the committee structure will be. All right, so the first subcommittee that we've set up is the Subcommittee for Wage and Equity Parity, system-wide. I met with, yesterday, Commissioner, Regional Center Director Rufus Brett, and we met with Pat Malley. And this is the committee we've come up with. What we want them to do is review the salaries at DDSN, bonuses and pay structures, review state guidelines, market demands, job requirements, education experience, and compare the salaries. Meet with stakeholders across the state to determine salary needs and receive input. Develop salary structure without compression that we could look at job descriptions, job performance, completion of training requirements, develop bonus structures to encourage longevity in employment, research cost of living, verify employees are earning a living wage, possibly look into adjusted rate for metropolitan areas, and report back to the commission any major discrepancies they see, as well as recommend adjustments to the commission based on this review. The people that I'm appointing to this committee would be the CFO, Pat Malley. The chairman of this committee would be Commissioner David Thomas. Commissioner Robin Blackwood is going to serve as Finance Committee Chair on there. Ryan Way of Clarendon County DDSN has agreed to serve. Tyler Rex with Thrive Upstate has agreed to serve. Evelyn Turner with Charleston County DDSN has agreed to serve. And then Rufus Britt will represent our regional centers, and HR Director Liz Lamont. I always have trouble with her. I get she and Lamel mixed up. Liz Lamont and is agreed to serve. So those are the subcommittee for wage equity and parity, and that's the purpose of them. Constance, do you want to add anything to that after our discussion yesterday about what we're looking at?
No, I just wanted to make sure it's clear that it's wage and equity parity for system-wide as far as direct care
Yes.
providers. Initially, there was some confusion about whether this committee was comprised to look at state employee salaries,
That's right.
but it's about the provider network.
Yes, because the state salaries are set by the state, but the provider salaries are not. So that's why we're trying to come up with a system that really helps solve that problem. And that's something that we heard repeatedly in the field, as we went around, that for example, $15 in Charleston is completely different than $15 in Clarendon. So there's a discrepancy there that we've got to figure out a way to compensate for. What do you all think about that? Do I have a motion or anything on that?
I know we're doing committees all at one time.
What? You want to do them all at one time, or you want to do them separately? You got to tell me.
Do them all at one time. I'm comfortable with that.
You're comfortable with all at one time? Okay. All right, so that's the first subcommittee. The second one is the subcommittee you all asked me to put together at our last meeting, is the subcommittee for FMAP oversight. Pat Bally will serve as the CFO, Commissioner Robin Blackwood as the Director of Finance, Commissioner Eddie Miller has been appointed to serve. Family member Michelle Woodhead from Rock Hill has agreed to serve. Dawn Johnson, Florence County DDSN Executive Director, has agreed to serve. And then private provider Craig Bird, who is with the CHS Group of South Carolina, has agreed to serve. And then once we hire a new internal audit director, they will also serve on that committee. That committee, I'm thinking they will meet on Teams monthly to review the expenses out of the FMAP money, the disbursements, verify the money is being spent as directed by the commission and within federal guidelines. This committee will report back to DDSN Commission Chairman immediately if any findings or discrepancies are identified so they can be addressed and remedied. Is that how you all see that? Is there any changes or amendments that need to be made to that? Okay, so that's FMAP.
We voted, I believe.
To let me do, yes.
Yes, we,
Approve the FMAP.
approved the budget, yeah.
Yes,
at the
we
same
agreed to let me
time.
do it, and I
Yeah.
just brought back the members. That's what I was supposed to be doing. All right, so the communication subcommittee, we set that up during Commissioner LaBelle's term. I would like to continue that because we are still going to be making some changes to our facility here. There's some things that I know that Michael brought to me yesterday. And so that will go through the communications committee of things they're planning to do to our room and that sort of thing. That will still go through you all. So I want to reestablish that committee and keep it in place. Barry Maniforth is going to serve as chair. Rob McBurney is the interim legislative liaison, will serve on that committee. The IT staff, which would be Michael, Mickey. Colleen Honey is the administrative coordinator for that group. Kenny Sumner, who is the systems programmer developer here at DDSN that works on our website, will be serving on that committee, as well as Commissioner Blackwood, who will be working with the PR group to work on press releases, news conferences, that kind of thing. And then committee member Eddie Miller took a real liking to our listening sessions and wants to take that on as a project that we will do every so often, is to go into the community and do listening sessions. So that is kind of the structure of that program, and what we were looking for is to handle those issues. Does that sound okay to you all? Okay. So that's that subcommittee. There's two more committees. One is our training task force, and Commissioner Gary LaMelle has agreed to take this on as a project. I'm appointing Commissioner Gary Kosher. He's a physician, an eye doctor, and so he understands the medical side of that. So I'm asking him to serve as with Commissioner LaMelle. I'm also appointing Ann Dalton to that. She is quality management. Kyla Schultz with risk management. Hester Wanamaker, technical assistant and training. Michael Mickey will serve there. Rufus Britt will serve as Operations Associate State Director, and Jake Holt, who is a certified behavior analysis and support analyst out in our community. We're also going to add a human resources person to that committee. We aren't sure who that's going to be just yet, but we will be adding an HR person to that. The purpose of that is to standardize online training modules to be used annually by DDSN employees and establish training modules to address the following: safety, hygiene, behavioral management, first aid, DHEC guidelines, FERPA, abuse and neglect, and anything else that committee thinks needs to be made into something standardized that we can look at and see. They're going to recommend the commission plans to incentivize DDSN DSPs to complete training, recommend scholarships, grants, tuition reimbursement, and/or bonus programs to incentivize DDSN direct service providers to pursue education, continue working for DDSN while and after obtaining their education. I want them to really look at it, study it, figure it out, and bring us back a plan that we can truly put our hands around. I know there was some, what was the thing we were talking about yesterday? The assessment tools is the other thing. The other thing, and it's not on here on this list, but is to look at the assessment tools and make sure that all of our assessment tools are actually serving the purposes that we intended them to serve. And that if something can be done differently, we need to know what it is and what's the best way to do that. So that is our committee there. Autism Task Force. Commissioner Blackwood has taken this on as a project, and I really appreciate it because she is truly our guru when it comes to this subject. And she will have, I'm giving her the authority to appoint committee members to this because she actually has expertise in this area. And so she is going to bring those names to us as she gets her committee completely filled. I know that she has added Angela Murhead, the Executive Director of Beautiful Gate Center down in Mount Pleasant, to her committee, Rufus Britt, and Daniel Davis, who is over autism for us, and then the community leaders in this field are who she will be adding to that committee. Robin, do you want to kind of expand on what your expectations are for that committee?
Sure. When we're out, oftentimes in the community, when we're talking with constituents, when we're listening to folks that live in our community, that receive services through DDSN and other providers because of an autism diagnosis, there's a lot of needs in our community. We as a state need to better support and care for individuals with autism. This is just an effort to gather input to address specific issues for all ages of consumers that have autism, to just better serve the public and help improve the quality of life for those impacted by autism. I look forward to, leading this task force and hopefully making some important changes for the better when it comes to autism in our state. So,
well, thank you for agreeing to serve and for putting that committee together for us, that task force. The final task force that I have for you, and I'm really excited about this task force. We actually started the process this week. Several of us met and kind of put together this list of people that we've decided to work on this project. It's a task force for ICF reform and improvement. I will serve as the chair, as the commission chair. I will also serve as the subcommittee chair for this project. Constance Holloway will serve as the DDSN interim director. Executive Director Robin Blackwood is serving as finance. Barry Malfors has agreed to serve. Jacob Flowers with our legal count team will also be serving on this. Rufus Britt, our Associate State Director of Operations. Julie Cook, Risk Management Coordinator. Ann Dalton, Director of Quality Management. Andrew Theron from Engineering. You're welcome, Andrew. Lori Cordell from the Burden Center. Ralph Courtney with Aiken County DDSN. Shantina Jett, Lee County DDSN. John Hitchman, Sumter County DDSN. Gene Bowman, Program Manager for the Regional Center Operations. Rob McBurney, Interim Legislative Liaison. And Regional Center Facility Administrators will all be included on that, and as well as the Regional Center Parents and Family Council Chairs. The issues we're going to look at and we're going to address are security, cameras, behavioral intervention, management, staffing, training, abuse and neglect, rate enhancement, food services, facilities management and upkeep, transportation, and capital improvements. We're going to go in and take an in-depth look and figure out what needs to be done and really focus on improving the quality of life for those in our regional centers and our ICFs. Is there any other questions with regards to any of these subcommittees? Yes, sir.
There's the gentleman who's on there is the behavior analyst, Mr.
Yep.
Holt. There's no contact information on there.
I have
for
him.
me.
I'll get to
Okay, I
you.
just did a quick search to see if I could find it,
I'll
and
get
I
to
have
you.
not been able to find it. So if we could just make sure you provide that. to me.
We met him at our, one of our
Listening session.
listening sessions.
Okay.
Yeah, that's right, that's right. So I've got that information. I know he works for the Georgetown DDSN and for,
Okay,
yes, so he'll be a great one for you.
that's great. I just
He's
didn't know
got
how to
some
get.
great
I just
ideas.
didn't know how to get that.
I tried to hire him that day. If that tells you anything. He was top notch. All right, is there anybody, have any comments, or does anyone want to make a motion to approve these?
I have a comment first.
Sure.
If you don't mind. I just wanted to say that for the record, I think, Rob McBurney is currently our legislative liaison interim, and he may be permanent, we don't know yet, but whoever the permanent one is who would.
That's
replace that.
correct.
Is that correct?
That's correct.
Okay, I just want to make sure that
Yes.
that's, for the record, we understand.
Yes, and anyone that is interim, for example, if Constance ends up not being the executive director, the position would step in.
I knew that, I just wanted it out here.
That is correct.
Thank you.
That is correct.
And we're not pigeonholed to the other staff that are
True.
named also, because there may be a need to add or remove staff members as we start flushing out these
Yes.
subcommittees.
There may be a need to add a different staff member of something.
That's true, but the commission members will stay.
Commission members will stay.
That's right. So that was the other thing we wanted to mention, is that she may decide one of the staff members needs to switch around.
That's right. The commission members will stay the same, but the actual staff may change.
Correct, I just wanted that for the record.
Okay, very good. Thank you, sir.
All
right.
I'll make a motion that we, based upon all that, I'll make a motion that we approve all the committees that we just talked about.
Wonderful, thank you. Do we have,
Second.
we have a second? So we have a motion and a second. Is there any further discussion on the matter? Hearing none, I'm going to call for the vote. All in favor, please signify by saying aye. All opposed, nay. Hearing none, the motion carries, and these are our standing and, what do you call them, temporary committees. Okay?
Task force.
Task force. I'm very excited about this task force. I think we're going to make huge strides here at DDSN, and I think we're going to make huge inroads into bringing our communities together and really working with each other. Okay.
You need to make sure that the details we talked about legislative liaison and other things are in the minutes.
Yes,
for
please.
the record. It's 10, whatever, 39, so
That's correct.
keep that in mind.
All right.
Thank you, sorry.
Wonderful. Now we're going to call on Ms. Susan Beck to do our IDRD waiver renewal update.
Thank you. Good morning.
Good morning.
I'll be brief today, but I wanted to just touch base with you all on the status of the intellectual disability related disabilities waiver renewal, as I've done each month since March. So you've seen me here before, of course. As you may recall, the waiver is due for renewal by January 1st, 2022. And we had geared up over the last year to have a submission ready on the DHHS side by June 1st. And within that, as I reported previously, we were looking at an increase in the cap, the limit for environmental modifications, adding in-home supports as a service, as it is a service now in the community supports waiver, and then also doing some work with the respite model and how that service can be delivered with multiple family members in a group. Is also a daily rate for group respite. We've also talked about an agency rate versus a self-directed rate. Then on June 7th, I think I reported last month to you all that DHHS initiated kind of a change in direction with an aggressive plan to take some of those services that we'd set aside for a future amendment, put them back on the table, and just expedite as much work as possible. So we've continued since that point to work on independent living skills and career prep, those changes to those services. We've just this week scheduled 3 meetings with DHHS and their rate setter Milliman, who I reported to you previously, will be working on all of these specifics to build some rates that before we were told they didn't have the time or effort available to work on rates. So that's very good news for the agency. Also assistive technology to add what they're calling a remote support access. We talked about that before, looking at waiver case management limits, and then of course residential. So that's the biggest workload, I think, in this expedited aggressive plan. So we've been cooperating with DHHS, Interim Director Holloway submitted to DHHS the DDSN information on July 9th, which was requested information about staffing and various rates. Within that request, DDSN asked for consideration of 8 residential rates, so I thought I'd just hit those real quick for you all. It's 4 tiers of 4-person homes, so that's kind of a graduated tier system with the, kind of a spectrum of most to least, most supports in tier 4 and least in tier 1. And then 1 3-person home rate suggestion, and then 1 supervised living program 2 rate, and then 2 tiers of community training home 1. So that all has to be fully considered and worked through with DHHS to see where we arrive, but that's the content that was sent over. We also continue to work on day services, and consideration is also being given to employment services, individual transportation. These are all things I've talked about before. I just want to kind of let you know where they sat. One thing I mentioned last month that we had some dialogue about was the interest in an acuity assessment. It's really just too short of a period to go through a process to implement acuity assessment in, a month or 6 5 we have left for the waiver renewal. So that would be going on a long-term plan for consideration. So no sort of ability to expedite that. So as informed by DHHS, this is kind of the timeline. By August 10th, they plan to have enough detail prepared to go to their advisory committee called MCAC, Medical Care Advisory Committee. On the 15th would be their posting for public comment. We've talked about public comment here before. CMS requires specific elements for public comment that are held by DHHS as a single Medicaid agency who really holds the waivers. We're just contractors. So they do that public comment. They'll do that through webinars at different dates and times and talk about kind of where they are with that. Their latest submission date of this waiver renewal, based on the timelines from CMS, would be September 30th. And then by October 2nd, that would be that time frame that's 90 days prior to waiver expiration, which is what CMS absolutely requires for submission. So that kind of gives you a feel for the landscape of where we are, what we've submitted, what's being considered, and what our timelines are given these adjustments. And I'm glad to answer any questions, but that's what I'm prepared to just give you a quick brief on today.
Thank you, Ms. Beck. Is there any questions for Ms. Beck? Yes, Mr. Will.
The rates that you're talking about, Susan, are these being set up in terms of 15-minute, hourly? When you say the rate, the number that's being generated as it relates to our move towards fee for service.
Right.
Can you give me just a little bit, I'm not going to details, but how that's going to relate?
So residential rates for the most part, hourly rate. Daily rates, excuse me.
Rates.
Yeah, daily rates. So we're currently paid 1 rate for the majority of our residential services.
Right.
However, DDSN's been putting out more funds than they obtain, right? And so it's a daily rate. So DHHS would be working with Milliman to work on all the details to build differentiated rates instead of the 1. Perhaps 8, we'll see where that sits because that's in their hands.
Okay. Has there been discussion about how a daily rate is going to relate to fee-for-service billing?
Well, so it's my understanding, Pat, help me out if you feel like I'm not explaining it correctly, but the initiative on DHHS's side is to allow for direct billing. Okay.
Right.
And so that's part of this waiver renewal they're also interested in.
Got
So direct billing allows fee for service, right? Excuse me. And then it would be at a daily rate is what we would anticipate it would continue.
So the fee for service would be based on a daily rate as opposed to like a 15-minute segment.
Correct.
Which I'm not saying it's a bad thing. I think in some ways that's better. But they also are envisioning the direct bill so that we don't get caught up in the administrative. Okay. All right. Thanks. That answers that question. I appreciate it.
Very good. Any other questions for Ms. Beck? Commissioner Thomas, do you have any questions?
I want to make sure Commissioner Thomas.
No question.
All right. Thank you, Susan. We appreciate it. All right. Moving on, we're going to do a band B and I issue and a band change and outline recommendations from Mr. Pat Maylor, our CFO.
Good morning. This is a report I've been giving for the last 3 months. This stems from the B&I transition to provide opportunities for providers to have outlier requests and ban requests, given the excess money we have into the system from taking back the ban Bs and Is. To date, we've had 38 requests. We've approved 10, denied 17, and 7 are going to be submitted today, and we have 4 pending. The 7 we're submitting today, staff recommends disapproving all 7. And the pattern that we're seeing is providers are making these requests, and our requirements for ban changes, particularly outliers, is to demonstrate that the provider has spent those funds and demonstrated they've spent excessive funds before we approve. And that requires financial documentation to show they have expended the funds before we approve, and that's been kind of the bottleneck where providers can't quite either gather that data or have that data to support the requests. And whenever we do the preliminary review, if we do not have sufficient data, we will send a letter back to them itemizing what we need and give them an opportunity to improve their requests. And if we do not get any more information, we deny the request. They're always welcome to submit next month, but we have to keep the process moving. And the process is based on justification, based on increased costs as well as need, but certainly costs. So what I have before you is attachment A, which is the specific 7 preliminary staff recommendations, which were not approving the 7 outlier requests. And attachment B is just a history of what we've done before. To date, we've approved just about annualized increase of about $260,000 a year is so far what we've approved.
I would make one note on attachment A. It says outliers for the June commission meeting.
Oh, okay.
We need to make sure that that's adjusted in the notes to July.
Those you're speaking of just now are ones we've already approved. We approved.
Yeah, they were the June decisions that we were rolling for July, but I think July is a little clear.
Okay. I just wasn't sure. Thank you.
We made the decision in June.
June.
It's not a different one.
No, these are different, right?
Yeah. See, since our last meeting, what we did, we have a cutoff.
I know these 7 are different, but the ones you're speaking of that we approved are not different than the ones from last month, correct? This is not additions. We're not approving any additional ones.
That's correct.
I want to make sure we're clear on that because I wasn't.
Okay.
I think the reason they June is like we will have a cutoff probably the end of June, and then those we end up in this report.
Yes.
So
the June.
it shows up in the July agenda.
Okay.
And if some come in early July, we'll slam them in there to see if we can get them approved.
It just said June commission meeting,
Yeah.
so I want to make sure we are doing this in July. All right. Is there anything else? Any comments? Do I have a motion?
Well, except, let me just make a comment. I think this is we are moving in the right direction in this regard. For the many years that I was on a county board, there wasn't a systematic way to, as far as I can understand it, to whether you approve these or not. And I just want to commend the staff on having a much more systematic way to do this. And that does include denials, which often are needed. And I am thankful for that because before it was very much not that way. And I heard about it for a very long time and of the impartiality that was used. And I'm very thankful that we're moving in the right direction. I'm sure there are improvements that should be made and could be made, but at least we are moving in the right direction. So I would move that those 7 were denied.
Okay. Do I have a second on the motion?
Second.
All right, motion is second on the floor. Is there any discussion or questions regarding this matter? Hearing none, we're going to vote. All in favor of denial of these 7, please signify by saying aye.
Aye.
All opposed? Hearing none, the ayes carry, and these 7 are denied. Okay?
Thanks.
Okay, next item on the agenda is our Regional Center Workforce Initiative. Ms. Constance Holloway and Mr. Bruce Britt are going to give us a report on this.
Good morning.
So Rufus and I are gonna tag team on. I think I'm slated to go first, right? So I'll be very brief. As interim director, I'm excited to announce, with support from the commission, DDSN plans to strengthen services at South Carolina 5 regional centers. In June of this year, I issued a memorandum to the Regional Center Facility Administrators. That memorandum is included in the packet. I believe it's in tab 7. And the purpose of the memorandum was to reemphasize zero tolerance for abuse, mistreatment of individuals in our care. I'm not going to read the memorandum if you guys would like to read it. In an effort to re-emphasize and help with the training to address abuse, we have partnered with the South Carolina Department of Aging. I executed a memorandum of understanding with that department sometime this month. 8th day of July. And the purpose of the agreement, and that agreement is also included in tab 7 of the packet. Under the agreement, Department of Aging will produce content and training videos that will help to DDSN to better train direct care staff in the onboarding process and throughout the year. DDSN hopes that the training will help to eliminate abuse and neglect cases and improve the overall quality of care of all of our residents. I want to make sure I express thanks to the Director of Aging, who is Connie Munn, and all of her staff. We've worked collaboratively for months, first discussing this training, and then figuring out how the agencies could work in collaboration to assist each other with the training. So I want to make sure I thank her and her staff for that. Finally, Chairman Rawlinson has already announced the creation of a new task force for ICF reform and improvement. That task force is comprised of several members of the commission, to include the chairman, DDSN staff, and other vital members of our community. It is our hope and plan for this task force to also aid in the effort to the overall quality and care of our residents. Rufus is going to give you a brief update on the initiatives that we've taken internally and plans that we foresee for the future.
Yeah, and definitely a special thank you to Dale Watson, the State Long-Term Care Ombudsman.
Yes.
As well as Nicole Hare, their General Counsel, and internally Gene Ballman and Rob McBurney were also instrumental in helping establish this memorandum of understanding, which I think is going to be vital, and also recognizes that our openness to partnership with other state agencies to address deficits that we have in our system.
That's wonderful.
Yeah. In tab 7, you have a summary of some workforce initiatives that we've employed and that we will employ in the future. As you all know and heard throughout the listening forums, the staffing crisis is widespread. The lack of direct support professionals and frontline workers, a lot of professionals have never seen it this bad. Just yesterday, I talked to at least 2 executive directors about, one, they're working in coverage on a regular basis. Some actually operate in multiple counties, and so they're actually driving from Columbia to go to Greenville to pull shifts. And wanted to discuss possibly closing operations because of the significant shortage of frontline workers. And so we've shared some initiatives that we've employed here at DDSN, which we're starting to see some of the fruits of that labor. A lot of these ideas germinated from direct engagement with frontline staff. We've been making a lot of weekend and evening visits to directly engage our frontline workers to hear about the challenges that they're facing day in and day out, and they provide us some really good feedback. So a lot of these initiatives that you read in tab 7 came directly from complaints and concerns voiced by our frontline workers. We've also issued some surveys to mid-management and other positions within the regional centers to gain feedback as to what we can do to improve the working conditions. We're actioning those items to include improving communications and hosting more town halls, and again, making more visits directly to the centers to talk to staff on a regular basis so that they hear from leadership and know that we're listening, and that when we hear a good idea, we actually action it. So it's not just lip service. So we've employed, as you will see in the documentation, several initiatives to address chief complaints and suggestions from our workforce, which I think is vital. We'll continue to do that. We have a number of activities planned to enhance onboarding and on-the-job training, which is another chief complaint that we heard directly from our workforce. We're looking to employ technology that to not supplant, but supplement some of the efforts to make sure that we provide better health care to individuals with specialized health care needs, And so we're working with a vendor through Henry Schein to demonstrate telehealth and telediagnostics at Coastal Center, and we may migrate to another center, but we're going to start there because of our partnership with some of the physicians at MUSC. So we're really excited about a lot of the initiatives that we're employing to not only increase safety, but also accountability. And I've talked to some of the commissioners about reconstituting positions that have been lost in the past that are really bona fide key positions that can help reinstall accountability and 24/7 supervision. And so we'll be embarking on those initiatives in the coming days and weeks.
Wonderful, wonderful. Any questions for Mr. Brett? I commend your staff, and you've worked very, very hard this last month to put all this together for us. I've really enjoyed meeting with you all. I think Commissioner Thomas, Commissioner Malfris and Blackwood were on that call with me as well with you all, and it was very well done. And I look forward to seeing the ideas that come out of this new task force. I think I join with my fellow commissioners and appreciating you for sending out the memorandum of understanding for zero tolerance. Is there a motion that we encourage them to move forward with this process?
I would so move.
Do I have a second?
Second.
Okay. Any discussion? Hearing none, we're going to vote to let you move forward with all of this. All in favor, please signify by saying aye.
Aye.
All opposed? Wonderful. The motion carries, and we look forward to working with you and helping make these regional centers truly standard of care for our consumers.
Thank you.
Thank you, Bruce.
Madam Chair, can I have a quick question?
Sure.
With regard to the memorandum, the memorandum of understanding, a lot of this is training. As the recently appointed person on the task force on training.
Yes.
I guess, what's the vision of how what I'm supposed to be doing interact with this?
Yes.
And would it make sense for us to add somebody
Yes.
to the subcommittee from Department of Energy or the Ombudsman's office? It looks like there's definitely some crossover between what you just asked me to do and what the memorandum of understanding is addressing.
Yes.
Not 100%, but
Yeah, we
certainly
could
some
definitely
crossover.
reach out to, we've been working, what's the young lady's name?
Nicole Hare, the general counsel, and Dale Watson, who's the long-term care ombudsman's office. They've been so
I'd like
great.
to see them added to
And
that
ask
task
them
force.
to join
Yeah.
that subcommittee.
Yeah, I mean, it seems like there's a lot.
Yeah,
I think that's great.
The idea is that we're creating these modules
We can
for
work
long-term permit, that they're doing the same thing, essentially.
Yes.
And Rufus may have some other folks that he wants to add. I know we talked yesterday briefly about some programs and things he was looking at that I think would be beneficial. So we probably need to add some of that in there as well.
Yeah, it'd be nice if we could reach out.
And I have no problem with that. Does anyone else have any problem with them adding? I think that's important that we keep these subcommittees flexible, that we can bring in these experts and bring in whoever we need that can help us get to maximum performance for this agency. Okay?
Thank you.
Thank you, Commissioner Mel. I appreciate that. All right, let's see, where are we, Constance? Okay, Pat, financial update.
Good morning again. I want to thank Mike Mickey for not making fun of me for pulling the mic up in front of me that doesn't work. You go to tab 8, we have our monthly expenditure report, and I just want to take a few minutes just to explain what we're going to try to do in this upcoming year. This expenditure report is a cash basis report. And down there in yellow in the middle, it says we spent $668 million this year. That's as of June 30th. We're in the middle of year-end closing to make sure that we're pulling all of all bills that are still outstanding in July and that actually occurred in the prior year to pay. That number is going to go up to about $688 million once we get all the accruals done and we close out our books, hopefully today. And that's about $20 million less than last year. And when I look at that, last year was a crazy year with COVID, with many ups and downs, and some of them wash out, but certainly the most significant cost reduction we had last year was approximately $20 million in at-home day services not provided due to COVID. That's not the singular explanation, but that's the main explanation for the drop in expenditures. Going forward, what we're going to try to do this year, we are going to do this year, is the challenge has always been when we come up with a spending plan, which we'll present in August, when we execute that plan, an increasing number of our expenditures flow through HHS, and we only pay the match. So our spending plan's at 100% dollars, and yet 100 million of our dollars is we only pay the match because of reimbursement. What we're going to do is we're going to every month calculate that difference so that you can see as the year goes on a much more accurate number. Is our budget staying within the spending plan expectations? So that adjustment, we've tried to address it a couple times the last couple of years. The state Medicaid plan has caused us some calculation inaccuracies, but I think this year we're going to finally lasso that so that you can see every month a much more accurate number. A couple of things while I have you here. Since the June meeting, the General Assembly and the governor has finalized our budget, and we've gotten 8 budget items. I'll cover real quick. Just we've talked about them a number of times, and I just want to thank the General Assembly and the governor because in January of this year, things were looking pretty dark for our budget, all budgets. And then by the end of the year, we ended up getting $11 million in state funds, which will turn into $23 million in match funds, which is phenomenal. We have $10 million increase for residential waiver residential settings, $7.2 million for respite. The writing is pretty small here. We have $1.5 million for the coastal electrical system. We got Special Olympics, $250,000. We have a new initiative, community housing pilot that members of the Senate were interested in, and they funded it for $750,000. And we'll have to get a little bit more information on the direction for that pilot. Union County Greenhouse, $15,000, and Greenwood Genetics, $2 million, and $1.8 million, which was a transfer from HHS to ourselves through the appropriations, which pays for state plan expenses for new waiver enrollees. So I thought that was a phenomenal increase given the budget you were in.
That increase for waiver renewal?
$1.8 million. And that's actually 2 years of funding. We didn't get ours last year, and they made it up this year. And that's all I have.
Can you give us an update real quick on the cost report situation? What that is?
The fiscal year 19 cost reports are over at HHS. I traded emails with Jeff this morning. He's going to look at them tomorrow. Okay. And we've hammered them for the last 3 or 4 days. We have excess cost in the system, which we expected. And right now, Jeff's going to do his side of the equation and match our billings with the cost to come up with the difference. But most importantly, the 19 cost report will be a foundation for rate increases for all the IDRD waiver renewal Susan was talking about.
And the back cost report?
The 13 and 14 are waiting my review.
Okay.
And so they are complete until I have to put my signature on it.
Okay.
And the 15 cost report, we have all of the provider cost reports done. When we close on it, it would take 2 weeks. Again,
Okay.
the challenge of all this is the final review because of the way these things are woven together. But after wading through the 19 cost reports, my review will pick up. They're just waiting for my review.
Great. So we're maybe in August, we'll be able to see?
Oh, I think I should have the other 2 done probably in a week or so. And then 15 will be done hopefully middle of August. It's done, but it's just, we put it aside because 19 has been such, we had to get that right in order to get our rates right.
Okay, wonderful. We'll look forward to seeing that.
Okay.
Thank you. All right. Is there any other information? Let's see. I think that's all we've got on the agenda for today. We are going to go into executive session today in regards to internal auditor position and the legislative liaison position / public information officer position. And that is what the personnel matters. So we will go into executive session to discuss those. And so do I have a motion to enter into executive session?
Second.
All right, well, we will close out right now, but we will come back to close the meeting. We are now, this is the South Carolina Department of Disabilities and Special Needs, July 15th, 2021 meeting. We are now rising out of executive session. It is 4 o'clock? Almost, it's 3:58. 3:58, and we're entering back into a public session. I just need to announce that we did do executive session today in regards to the internal auditor position and legislative liaison and public information officer positions. We're rising out, no decision has been made, no motions made, no votes taken, and so we are back into public session.
I make a motion to adjourn.
Commissioner Blackwood has made a motion to adjourn. Do I have a second? Second by Commissioner Miller. All in favor of adjourning? I'm sorry, my voice got tied up. All in favor of adjourning, please signify by saying yes.
You need to announce that there's 2 people that are not present, but 4 people are, so we do have a quorum.
Okay, yes. Commissioner Miller's here. Commissioner Thomas is on the speaker.
Thomas is here.
Yes.
5 of us.
Yes, Commissioner LaBelle and Commissioner Cover had to leave to go to a meeting. So they did have to leave us during the executive session, but we rose out and we still have Commissioner Miller, Commissioner Malfros, Commissioner Blackwood, and Commissioner Thomas and myself, and Commissioner Thomas is on the phone. So I appreciate you all being here today. All in favor of us adjourning, please signify by saying aye.
Aye.
Nays? Hearing none, the ayes carry, and we stand adjourned.
Thank you, ma'am.
Um,